Welcome to the Northern Brain Injury Association's Crime and Addiction Reduction Education Services presentation on acquired brain injury and crime for justice and social service professionals. Created by the Northern Brain Injury Association. Funded by a civil forfeiture crime prevention and remediation grant provided by the Minister of Public Safety and Solicitor General. The Crime and Addiction Reduction Education Services, or CARES program, assists persons with a brain injury who are involved with the justice system. It helps them to understand the effects that brain injury has had on their lives, provides them with tools to help navigate life, and develops a comprehensive community support system to ensure the individual every opportunity for personal success. The purpose of this presentation is to empower community service providers and those delivering justice services with basic information about the complex challenges faced by persons living with a brain injury. About brain injury. Acquired brain injury, or ABI, is brain damage caused by events after birth, rather than as part of a genetic, neurodegenerative, or congenital disorder such as fetal alcohol syndrome, perinatal illness, or perinatal hypoxia. The common causes of acquired brain injury are trauma, chemicals or poisons, stroke or aneurysm, anoxia, infection, tumor, surgery, and blast or explosive force. No two brain injuries are ever the same. Effects vary widely from one individual to another. The effects of brain injury are determined by severity and areas affected. Concussion, the most frequent brain injury, was once thought to heal within 3 to 6 months. Science has proven this to be incorrect. Post-concussion effects may actually last many years and even be lifelong. Be aware that in addition to the effects of brain injury, the individual may also suffer from post-traumatic stress disorder from the traumatic injury. Let's begin with 4 very important points about brain injury. First, brain injury is often invisible. Second, brain injury does not decrease a person's intelligence. It only affects their ability to receive, process, and respond. Third, brain injury is not an excuse to commit crime. The majority of persons living with an acquired brain injury never become involved with the justice system. Fourth, up to 87% of inmates self-identify as having had at least one brain injury. About brain injury and crime. Brain injury can and does change people. Sometimes those changes are miraculous. Sometimes those changes are disastrous. And sometimes those changes can lead to crime and addiction. It's important to note that in these instances, crime and addiction are not the problem. Crime and addiction are the result of the problem. Once someone with a brain injury enters the justice system, it frequently becomes a revolving door for them. Breaking their cycle of crime and substance use requires education, case management, and integrated community support. Integrated community support begins with a better understanding by professionals about the effects of brain injury and how the effects relate to crime and addiction. About living with a brain injury. We begin by providing a basic understanding of who is going to be sitting across from you, what they are experiencing, and what you can do to help. The person across from you had their brain hurt, and it's extremely unlikely they received help beyond emergency care. They therefore had to learn to navigate life in ways very different than the uninjured. For those injured when young, impaired brain processes made learning far more difficult for them and may have delayed or inhibited development. Feeling inadequate, not as smart as, or as capable as others because of their injury often led to lowered self-esteem. There is a high probability they dropped out of school due to learning difficulties and compromised social skills. And due to anger outbursts, impulsivity, and difficulty following rules, there's also a high probability they left home at an early age. Many people injured later in life had to learn how to live all over again, literally relearning how to swallow, eat, speak, and walk. They experienced profound loss of self, role, and purpose. This caused social and emotional disorientation and sudden significant anger toward themselves and others. Regardless of their age at the time of injury, the changes that happened to them, combined with a lack of knowledge of why and what to do, led to a life of failed employment and relationships. They consider themselves stupid because they're unable to do things the same way as others. They also doubt their own injury because professionals without brain injury knowledge may have believed they were faking it, unwilling to change, or simply lacked the willpower to take charge of their lives. To survive, they learn to expect nothing and distrust everything. Emotional detachment helped keep them physically and mentally safe. Impulsivity, lack of emotional control, slowed processing, and a compromised sense of consequence often cause their initial involvement with the justice system. Inability to socialize, volatile emotions, behavioral challenges, physical pain, depression, and a lack of self-worth may have led to some form of self-medication. Here's an important note. A danger of self-medication by a person with a brain injury is that substances may have a very different effect and intensity on an injured brain than they have on an uninjured brain. Obtaining and using substances to self-medicate led to criminal associations, victimization, and in many cases, ultimately to addiction and committing acts of crime. All of this has led them to sitting across from you. About what you can do to help. There's a lot that can be done to assist the injured person with managing their issues. It just requires a little information, a dynamic team to support them, and a great deal of patience and compassion. Begin by seeing them for who they are and what they struggle with, not what they've done or who they've become. Give them the same level of respect and dignity that you would extend to anyone outside of their circumstances. This may require you to put aside your personal biases, beliefs, and opinions, and perhaps even alter entrenched perceptions based on new information. Opening up to you will take incredible bravery, and learning how to live a productive and rewarding life will be very difficult. So please acknowledge and commend their efforts. About changing behaviors. Given all that the person survived after injury, they will no doubt exhibit challenging behaviors. Some will be learned, but many will be misunderstood effects of brain injury. Here are a few behaviors common to brain injury that may erroneously make the injured person appear uncooperative and/or disrespectful, and why. Failure to respond quickly to questions and directives. A slowed processing and response time means it takes them much longer to absorb, comprehend, and respond. Inconsistent attention. A short attention span, easily distracted by a racing mind, sights, smells, and sounds. The inability to ask for help. A fear and difficulty articulating thoughts to request help leaves them frustrated and reluctant to try. Impulsivity, emotional volatility, spontaneous, great difficulty controlling emotions may exhibit inappropriate responses to situations. For example, anger at jokes and laughter at bad news. A difficulty remembering prior discussions. Impaired short-term memory may cause them to forget conversations, even ones that have just happened moments before. Difficulty following directions. A poor memory and difficulty sequencing. Difficulty learning routines. Again, poor memory and difficulty sequencing. Difficulty expressing feelings. Unable to understand what they feel, let alone explain it to others. Difficulty staying awake. Disrupted sleep patterns, emotional flooding, and energy crashes can all contribute to this. Difficulty with rules. Impaired memory makes it hard to remember rules, and impulsivity causes them to be broken. Difficulty with groups. Impulsivity, short attention span, lack of emotional control, memory issues, combined with an inability or unwillingness to follow rules. Failure to follow court-ordered conditions. Causes include disrupted sleep patterns, poor memory, compromised health, substance use, and lack of transportation. Failure to comply with court-ordered conditions often results in continual re-entry into the justice system. In fact, many inmates in custody aren't there for committing an offense. They're in custody for breaching conditions. Brain injury has significant association with higher recidivism rates. This suggests a significant reduction in recidivism by individualizing release conditions and supports for those living with the effects of brain injury. About what the person is experiencing. Here's a basic idea of how the person may feel when they come to see you. Fearful, anxious, apprehensive, exhausted, self-hating, worthless, guilty, angry, depressed, violated, misunderstood, victimized, helpless, frustrated, hopeless, pointless. And that's before they ever open the door to your office. Once inside, add to their challenges a kaleidoscope of sights, sounds, and smells that an uninjured brain routinely filters out. Things like bright lights, the gentle gurgling of a water fountain, the low hum of a computer, the soft buzzing of fluorescent lights. Bright lights can blind and overwhelm the brain after injury, so many survivors will wear a hat and sunglasses indoors. Some also use earplugs to reduce noise. For some, the high-speed pulse of fluorescent lights may make it seem like they've walked into a dark room with strobe lights flashing very quickly. This is distracting, disorienting, and can cause queasiness and headaches. After injury, changes to auditory processing may cause all sounds to be received by the brain at the same volume and all at once, making it very hard for them to filter one sound from the others. This means the person hears the sound of your computer, someone talking in a hallway, and or a fire truck going by with siren blaring all at the same volume as your voice. This can make it extremely hard to understand a simple conversation. It's even more difficult to follow a conversation when more than one person speaks at the same time within hearing range. And to make listening even more challenging, their injury may have caused the onset of a sporadic or persistent loud buzzing or ringing in their ears, known as tinnitus. Changes to their olfactory sense may cause the smells of food, air fresheners, scented candles, or perfumes that are pleasing to most people to be nauseating to them. And they may be in considerable pain for which they're not being provided with relief. Neurological pain is invisible and often has no apparent or identifiable physical source. This can cause doctors to doubt its existence. About helping the person. Helping them begins with accepting that previous attempts to straighten out their life have not worked, most often because of unrealistic expectations. Many people have tried to fix them and failed because there is no fix. Brain injury requires management, not treatment. Knowledge about brain injury empowers service providers and community corrections with tools needed to significantly help survivors of brain injury. About what to do. Establish open communication with the person's case manager to learn about the person's needs and triggers, and inform the case manager of how they can best assist you. Don't demand or expect the person being helped to trust and respect you. You'll need to earn it. This is very important to their successful development, yet given all they've been through, can be very difficult to do. Difficult, but not impossible. Just know that you may well be one of the few people in their life who cares enough to learn about what's happened to them and is willing to help. Just a note, humor can be a wonderful icebreaker and learning tool, but brain injury may inhibit a person's ability to comprehend it, so know there's a chance the person may take it the wrong way. To relieve stress and improve communication when meeting, we recommend the following. Be flexible with meeting dates and times. Suggest the person bring someone to assist them, to take notes and remind them of things. Keep meetings short and provide breaks as needed. Meet in a quiet, softly lit room with as few distractions as possible. Make sure the person knows that you're speaking to them. Ensure that only one person speaks at a time. Speak slowly. Use easy-to-understand words. Ask one question about one thing at a time, and use sentences that are short and to the point. Allow lots of extra time for the person to process and respond. Let them finish their thoughts without interrupting or finishing sentences for them. Make sure they've understood what you said. Ask them to repeat what you said and explain what it means. Repeat as needed. Review what was agreed to at previous meetings and what was just discussed. Then provide requirements, instructions, and appointments in writing, by text, and email. In closing, there's so much that we can do to help persons living with a brain injury when we understand what they're going through and provide the help that they need. This concludes the Northern Brain Injury Association's Crime and Addiction Reduction Education Services presentation on brain injury and crime. We hope it provides you with a greater understanding of brain injury, the complex issues that are often lived with, and how brain injury can relate to crime. Please also watch the CARES presentation about acquired brain injury, substance use, and addiction.